I am Dr. Jocelyn, and today we will explore something that has generated considerable buzz in the HELP community lately. We are talking about a simple and accessible vitamin that you can place right under your tongue and that can change the game when it comes to maintaining healthy testosterone levels after reaching adulthood. Now, before we dive into the details, I want you to find a comfortable seat because what I am going to share with you today will challenge some of the things you may have heard about testosterone support. And believe me, by the end of this video, you will understand why the sublingual method, which is placing something under the tongue, is becoming the preferred choice of so many men who take their vitality seriously. Let me start with a story. Last month, a patient came to my office. Let's call him Robert. Robert is 56 years old, works in construction, has always been active, always strong. But lately he told me he had been feeling strange. His energy was dropping by mid-afternoon, his recovery after workouts was taking longer, and he simply didn't feel like he used to. His words, not mine. Sounds familiar? Well, Robert's story is the story of millions of men over 50, and it all comes down to one crucial hormone, testosterone. Now, here's the deal about testosterone. After age 30, your testosterone levels start to naturally decline by about 1 to 2% each year. Do the math with me here. By the time you reach 50, you could be facing a drop of 20 to 40% from your peak levels. That's significant. That's a significant life change. And this decline doesn't just affect your energy or your muscle mass. We're talking about your mood, your cognitive function, your bone density, your cardiovascular health, and yes, your intimate relationships too. But this is where it gets interesting, and this is what most people don't understand. The problem is not always just how much testosterone your body is producing. It's also about how well your body can actually use what it is producing. And this is where our star ingredient comes into play. Signs that you may have low testosterone. Let me introduce you to vitamin D3. Now I know what you're thinking. Vitamin D, that's the sunshine vitamin, right? What does that have to do with testosterone? Well, let me tell you, the connection is much more powerful than most people realize. And the research supporting this is absolutely fascinating. Vitamin D is not technically just a vitamin. In fact, it is a hormone precursor, which means your body uses it to produce other hormones, including testosterone. Several studies have shown a direct correlation between vitamin D levels and testosterone levels in men. In fact, a pioneering study published in the journal Hormone and Metabolic Research found that men who supplemented with 3,332 international units of vitamin D daily for a year had an increase of approximately 25% in testosterone levels. 25%. This is not a small increase. It is a significant, measurable increase that can change lives. The secret of the vitamin under the tongue explained. But this is where the sublingual method comes in, and this is crucial. When you take vitamin D orally, that is, by swallowing a tablet or capsule, it has to pass through your entire digestive system. It is broken down by stomach acid, processed by the liver, and only then does it enter your bloodstream. This process can take hours, and you lose a significant portion of that vitamin along the way. Studies suggest that the oral absorption rates of vitamin D can be as low as 50% in some individuals, especially in those with digestive issues or as we age and our digestive efficiency declines. Now, when you place vitamin D under the tongue, something remarkable happens. The mucous membranes under your tongue are incredibly thin and highly vascularized, which means they are filled with blood vessels. When you place a sublingual vitamin D supplement under your tongue and let it dissolve, these active compounds are absorbed directly into the bloodstream, completely bypassing the digestive system. This means faster absorption, greater bioavailability, and more of that precious vitamin actually reaching the site where it's needed. We're talking about absorption rates that can reach up to 90% or more. And you start to notice the effects in 15 to 30 minutes instead of hours. Now let's talk about dosage for a moment, because this is where many men get confused. The recommended daily intake of vitamin D is 600 international units for most adults. But here's the problem with that recommendation. It was created to prevent deficiency diseases like rickets and not to optimize hormone levels for testosterone support. Research suggests that most men over 50 need something between 2,000 to 5,000 international units per day, depending on their current levels, sun exposure, body weight, and individual health status. Here's one more thing you need to know. If you are deficient in vitamin D, and statistically speaking, about 42% of American adults are, you will not see optimal testosterone production, no matter what you do. But vitamin D doesn't work alone. And this is where we need to talk about the lineup of ingredients that can enhance their effects and create a comprehensive approach to testosterone support. Let's talk about zinc next. Zinc is absolutely essential for testosterone production. It is involved in the conversion of cholesterol to testosterone and also helps inhibit the aromatase enzyme, which converts testosterone to estrogen. Now here's the problem. Zinc deficiency is extremely common, especially in older men. Studies have shown that zinc supplementation can significantly increase testosterone levels, particularly in deficient men. One study found that men with low testosterone who supplemented with 30 milligrams of zinc daily for 6 months had their testosterone levels nearly doubled. This is something powerful. The sublingual administration method of zinc is particularly interesting because zinc can be harsh on the stomach when taken orally, causing nausea in some people. But when you take it sublingually, you completely avoid the stomach, reducing the risk of digestive discomfort and improving absorption. The ideal form for sublingual use is zinc citrate or zinc gluconate, as these forms dissolve well and are highly bioavailable. Now let's talk about magnesium, another often neglected mineral that plays a crucial role in testosterone production. Magnesium is involved in over 300 enzymatic reactions in your body, including several that are directly related to testosterone synthesis. Research shows that magnesium supplementation can increase free and total testosterone levels, especially in men who exercise regularly. A particularly interesting study found that athletes who supplemented with magnesium had a 24% increase in free testosterone levels after just 4 weeks. The sublingual form of magnesium, usually magnesium chloride, is absorbed exceptionally efficiently through the oral mucosa. And since magnesium also supports sleep quality, and we know that testosterone production peaks during sleep, you're getting a double benefit here. Poor sleep is one of the quickest ways to lower your testosterone levels. Therefore, anything that improves sleep quality while directly supporting testosterone production is a win for me. How does sublingual absorption work faster? Now let's talk about something a bit more exotic, boron. Boron is a trace mineral that most people have never heard of, but the research on boron and testosterone is absolutely compelling. Studies show that supplementing with just 6 milligrams of boron per day can increase free testosterone levels by nearly 30% in just 1 week. How does this work? Boron appears to reduce the amount of testosterone that binds to sex hormone binding globulin, which means more free testosterone circulating in your bloodstream, where it can actually take effect. Boron also seems to reduce inflammation and support healthy estrogen metabolism, which is important because as men age, they often experience an increase in estrogen levels relative to testosterone, a condition sometimes referred to as estrogen dominance. By supporting healthy estrogen metabolism, boron helps maintain this crucial balance between testosterone and estrogen, which is so important for male vitality. Sublingual administration of boron ensures rapid absorption and utilization. Since it is needed in such small quantities, a sublingual tablet can provide the perfect dose without the risk of overdose, and you will feel the effects much faster than with oral supplementation. Now let's talk about vitamin K2, specifically the MK7 form. Now you may be wondering what vitamin K has to do with testosterone, and the connection is fascinating. Vitamin K2 plays a crucial role in directing calcium to where it belongs, your bones and teeth, and away from where it does not belong, your arteries and soft tissues. But recent research has uncovered another role. Vitamin K2 appears to stimulate testosterone production in the Leydig cells of the testes. Animal studies have shown significant increases in testosterone production with vitamin K2 supplementation. And while we need more studies in humans, the preliminary evidence is very promising. The reason we specifically want the MK7 form is because it has a much longer half-life in the body compared to other forms of vitamin K, which means it stays active in your system for a longer time and provides more sustained benefits. When administered sublingually, vitamin K2 MK7 avoids first-pass metabolism in the liver, which means more of it remains in its active form and available for use by your cells. The best time and dosage to take it. Now, there is another ingredient that deserves our attention, and that is fenugreek extract. Fenugreek is an herb that has been used for thousands of years in traditional medicine, but modern science is now validating what ancient healers already knew. Fenugreek contains compounds called furostenolic saponins, which seem to stimulate testosterone production and, most importantly, help release bound testosterone, making more of it available in its free and active form. Clinical studies on fenugreek are impressive. One study found that men who supplemented with fenugreek extract had significant improvements in sexual function, energy levels, and general well-being, with corresponding increases in free testosterone levels. Another study showed improvements in strength and body composition in men who took fenugreek during resistance training. When fenugreek is administered sublingually, its active compounds are absorbed quickly and efficiently. The typical sublingual dose ranges from 300 to 600 milligrams of a standardized extract, and men often report noticing effects within a few weeks of consistent use. Let's also talk about vitamin B6, particularly in its active form, pyridoxal 5-phosphate. B6 is crucial for the production of neurotransmitters and hormones, and plays a specific role in regulating prolactin levels. Here's why this matters. Elevated prolactin can suppress testosterone production. By helping to keep prolactin levels in check, B6 indirectly supports healthy testosterone levels. Studies have also shown that B6 supplementation can improve mood and reduce symptoms of mild depression, which is important because mental health and testosterone levels are closely linked. Sublingual administration of B6 ensures rapid absorption and immediate availability for the biochemical reactions that need it. Since B vitamins are water-soluble, they are particularly suitable for sublingual administration, as they dissolve easily and are readily absorbed through the mucous membranes. Another powerful ingredient worth discussing is ashwagandha extract. This adaptogenic herb has been used in Ayurvedic medicine for centuries, and modern research now confirms its remarkable benefits for testosterone support. Ashwagandha works by reducing cortisol levels, which is your primary stress hormone. And here's why this matters. Chronic elevated cortisol directly suppresses testosterone production. It's a hormonal balance. When cortisol rises, testosterone decreases. Several clinical trials have demonstrated ashwagandha's ability to significantly increase testosterone levels in men. One particularly robust study found that men who took 600 milligrams of ashwagandha root extract daily for 8 weeks experienced an 18% increase in testosterone levels compared to placebo. They also reported improvements in muscle strength, recovery, and overall vitality. When administered sublingually, the active compounds in ashwagandha, especially withanolides, are rapidly absorbed and begin to act on stress reduction and hormonal optimization almost immediately. Now I want to address something important. All these ingredients I mentioned, vitamin D3, zinc, magnesium, boron, vitamin K2, fenugreek, B6, and ashwagandha, work synergistically. This means that they are more powerful together than individually. Each one supports testosterone production through different mechanisms, and when combined, they create a comprehensive approach that acts on multiple pathways simultaneously. That's why I'm particularly excited about sublingual formulations that combine these ingredients in ideal proportions. You're not just getting one nutrient, you're getting a complete system designed to support healthy testosterone levels from all angles. And because they are sublingual, you ensure maximum absorption and bioavailability of each ingredient. Let me tell you what happened with Robert, the patient I mentioned earlier. After reviewing his tests and noticing that his vitamin D levels were low and his testosterone was at the lower end of normal, we started a complete sublingual supplementation protocol that included all these essential ingredients. In 4 weeks, he reported feeling visibly different. His energy improved, his workout seemed easier, and he was sleeping more deeply. At the 12-week mark, we reevaluated his levels. His vitamin D went from deficient to ideal, and his testosterone increased by 32%. But more importantly, he felt like himself again. That's what matters. Not just numbers on a lab report, but real improvements in how you feel and function every day. Now, I know some of you might be thinking, can't I just get vitamin D? And yes, sun exposure stimulates the production of vitamin D in your skin, but here's the reality. Most men over 50 do not get enough sun exposure to maintain optimal levels of vitamin D, especially if you live in northern latitudes work indoors, or use sunscreen regularly. And even if you expose yourself to the sun, your skin's ability to produce vitamin D decreases with age. By the time you reach 70 years old, your skin produces about 75% less vitamin D with the same amount of sun exposure as when you were 20. Therefore, while I encourage sensible sun exposure, for most men over 50, supplementation will be necessary to achieve and maintain optimal levels of vitamin D. And by choosing sublingual supplementation, you ensure the most effective delivery and absorption possible. Let's talk about safety for a moment, as this is important. Vitamin D3, when taken in adequate doses, is extremely safe. The tolerable upper limit set by health authorities is 4,000 international units per day. While many experts suggest that doses of up to 10,000 IU per day are safe for most people, especially under close medical supervision, the secret is to monitor your levels. I recommend getting a test to check your vitamin D levels before starting supplementation, and then again after 3 months to ensure you are reaching that ideal range, which for testosterone support generally falls between 40 to 60 NAG per mil. The other nutrients I discussed, zinc, magnesium, boron, vitamin K2, fenugreek, B6, and the vaganda, are also very safe when taken at the recommended doses. The sublingual administration method adds an extra layer of safety as you use smaller doses that are absorbed more efficiently, instead of larger doses trying to compensate for poor oral absorption. One thing I want to emphasize is consistency. These are not magic pills that work overnight. Hormonal optimization is a process. You need to be consistent with your supplementation, give your body time to respond, and support these efforts with other healthy lifestyle choices. This means prioritizing sleep, managing stress, maintaining a nutrient-rich diet, regularly practicing resistance exercises, and keeping a healthy body weight. The sublingual vitamins and minerals we discussed are powerful tools, but they work best as part of a comprehensive approach to health and vitality. Let me share another quick story. I had another patient, let's call him Michael, who came to me with classic symptoms of low testosterone, low energy, decreased muscle mass, reduced libido, and a general feeling of malaise. He was 62 years old and had been told by another doctor that these symptoms were just part of aging and that there wasn't much he could do about it. I fundamentally disagree with that perspective. Yes, aging involves changes, but that doesn't mean we should accept decline without a fight. We started Michael on a sublingual testosterone support protocol and also addressed his sleep, stress levels, and exercise routine. In 8 weeks, his energy improved drastically. He returned to the gym and was really gaining muscle mass. His mood improved, his relationships improved, and he told me he felt like he had regained a decade of his life. That's the power of optimizing your testosterone levels naturally through targeted and bioavailable supplementation. Now, I want to address something that often comes up: the difference between natural testosterone support and testosterone replacement therapy. TRT involves obtaining synthetic testosterone through injections, gels, or patches. And while TRT may be suitable for some men with clinically low testosterone levels, it presents possible side effects and risks, including testicular atrophy, infertility, increased red blood cell count, and potential cardiovascular risks. Furthermore, once TRT is initiated, your body may stop producing its own testosterone, which means you could become dependent on it. Natural testosterone support through sublingual supplementation works differently. You are not introducing synthetic hormones. Instead, you are providing your body with the raw materials and cofactors necessary to produce and utilize its own testosterone more effectively. You are supporting your body's natural processes rather than replacing them. This approach is generally safer, has fewer side effects, and does not carry the same risks of dependency. That said, there are some men whose testosterone levels are so low that natural support alone is not enough, and TRT may be necessary for medical reasons. This is a decision that should be made in consultation with a qualified healthcare professional who can assess your individual situation, conduct the appropriate tests, and help you make an informed choice. For most men over 50, however, natural testosterone support through sublingual supplementation, combined with healthy lifestyle choices, can make a huge difference. And the beauty of the sublingual administration method is that you get pharmaceutical-grade absorption without the need for injections or prescriptions. You are taking control of your hormonal health in the most efficient and effective way possible. As we conclude, I want to leave you with a message. Your testosterone levels do not have to drop drastically as you age. Yes, some decline is natural, but the significant drops that many men experience are often due to correctable factors: vitamin D deficiency, inadequate sleep, chronic stress, poor diet, lack of exercise, and insufficient intake of essential nutrients. By addressing these factors and using targeted sublingual supplementation, you can maintain healthy testosterone levels into your later years. The sublingual method we discussed today, placing vitamin D3 and these supportive nutrients under the tongue, is a game changer because it maximizes absorption, minimizes waste, and provides faster results than traditional oral supplementation. It's simple, accessible, and backed by solid science. So, if you are a man over 50 who exhibits any of the symptoms we discussed, low energy, decreased muscle mass, slow recovery, reduced libido, mood changes, I recommend getting tested for vitamin D and testosterone and considering incorporating a high-quality sublingual supplement into your daily routine. Give it 8 to 12 weeks of consistent use and pay attention to how you feel. I think you will be surprised and pleased with the results. Remember, aging is inevitable, but decline is optional. You have more control over your vitality and hormonal health than you think. The sublingual vitamin D3 approach, along with its powerful supporting nutrients, is one of the most effective tools available to help you maintain your strength, energy, and vitality for many years. Thank you for watching, and here's to your health and vitality.